Hello, everyone. Welcome to the webinar, FirstNet Tracing and Collaborative Care Coordination. Thank you for joining us today. My name is Danny Ramey. I'm the editor of Mission Critical Communications, and I'll be moderating the webinar. FirstNet, built with AT&T, is the webinar sponsor. We have some excellent information and several expert presenters scheduled for you today. We will include time at the end of the webinar for questions from attendees and do our best to wrap up the webinar in an hour to be courteous of everyone's time. Our first presenter is Corey Ricketson, Vice President of National Accounts for Pulsara. Corey's goals at Pulsara are to make a meaningful impact on healthcare by helping clinicians deliver safe, efficient, and accountable care while changing the buying experience from a sterile process to an inviting partnership. Before Pulsara, Corey worked at Austin Travis County EMS in Texas, where he served in multiple roles, including rescue medic, flight paramedic, and special operations commander. After that, Corey worked at ESO Solutions in Handheavy. Our second presenter is Spencer Sullivan, Vice President of Partnerships for RumbleUp. Spencer works to identify strategic relationships with prospective and existing clients to help leverage the power of texting for all involved stakeholders. He works closely with the 1,000+ clients of RumbleUp, which consist of government entities, nonprofits, and political organizations. Before RumbleUp, Spencer was a political consultant for campaigns, committees, and PACs both domestically and internationally. He lives in Alexandria, Virginia with his wife and 2 daughters. Our final presenter, Marcus Molinaro, is the county executive for Dutchess County, New York. Marcus was elected as Dutchess County's 7th executive in November 2011 and was re-elected for his 3rd term in 2019. Marcus has been an innovator in New York, working to establish a holistic approach to dealing with residents' health. Marcus has served as a mayor, a representative for the 103rd District in the New York State Assembly, and is currently the 2nd Vice President for the New York State Association of Counties. Before we begin, I want to briefly explain a few of the user features of our webinar service. You will see the attendee control panel in the upper right-hand side of your screen. The control panel can be expanded or collapsed by clicking the icons on the left side of each pane. To the left is the GoToWebinar viewer through which you see the presentation. To the right is the control panel where you can ask questions and select your audio mode. The default audio mode is mic and speakers through your computer, but you can also click the telephone button and dial in using the number you received in your email. All attendees are muted to reduce background noise. If you'd like to submit a question for one of the presenters or myself, use the questions pane. Just type in your question and click send to submit your question. We'll reserve time at the end of the webinar for Q&A. AT&T has made a PDF of the slide presentation available. You'll see a handouts pane in your control panel. Click the name of the handout to access it. Your default web browser will automatically launch and open a blank page, and the handout file will start downloading to your designated downloads location. You can then click the downloaded file to open or save it. Finally, a recording of the webinar will be emailed to all registrants and be available at www.mccmag.com. In addition, a certificate of attendance will be emailed to all attendees about 24 hours after the webinar. Next slide, please. With that, we'll get started. Thank you again for joining us. First, an overview of FirstNet. FirstNet provides public safety professionals with a library of pre-evaluated mobile tools in the FirstNet app catalog. The catalog only includes approved apps that FirstNet has vetted, tested, and confirmed are relevant, highly secure, and reliable. This webinar and our future FirstNet app webinars feature a small number of the more than 160 apps that first responders and their supporting agencies are already depending on to address emergent needs. Through this webinar series, we are excited to highlight agency app stories that illustrate how FirstNet and FirstNet approved apps are reliably connecting people, places, and things through voice, data, and video in the field. You can find out more about FirstNet and FirstNet apps at firstnet.com. And feel free to submit any questions or requests for follow-up during the webinar. And now, Corey will begin our presentation. Over to you, Corey. Corey, I think you might be muted.
There we go. It's only been a couple years since we've been using these tools, right? So, no, thanks a lot for passing it over, and hopefully you guys get a lot out of this webinar, both from Pulsara as well as from RumbleUp. There's been a lot of things that we've learned, obviously, because of the COVID crisis, and my hope is that a lot of the efficiencies that we have innovated will stand true past COVID. So I'm going to try to make this informative and give you some tips and tricks on what we've learned as well. As it was said before, my name's Corey Ricketson. They kind of did an intro for you, but I've been sort of on the front lines in the COVID crisis and helping to manage surge and load balancing across many regions throughout the nation. But I'm going to highlight one of those at the end of this presentation with respect to El Paso and what we experienced in Texas. So first of all, I do want to throw out a couple of definitions. I think it makes sense for you to have a little bit of an understanding on a couple of key terms. The first is networked communication. What is that? I think of it like virality. You think about, if I give you a virus and then you give it to 2 people and then they give it to 3 people and then I give it to 2 more people, then that's sort of like how networked communication works, only it's technology based. So the thing to remember with this is that it's a many-to-many relationships. And that's what we're trying to build, is that network of people that need to communicate together and to be able to dynamically do that on the fly. Second thing I want to point out is a term that we use, that's systems of care that scale. And, I was a disaster guy before I got into technology. I was at Hurricane Katrina and a lot of major events. And what we found is that a lot of the things that we used during disaster just kind of hung on the shelf until the worst day of our life. And then we were expected to use these things, and it wasn't second nature. And so what we like to do is promote a way to use the exact same communication system daily that can scale in stress events. So for local, regional, state, and national stress events. And then finally, the last thing, as far as the terminology is concerned, is the Medical Operations Coordination Cell, or a MOC for short. This is a very accepted term by FEMA, ASPR, Tracy. And so what a MOC looks to do is to move patient, staff, and supplies to the right provider at the right time in the right way to improve patient well-being. So I also want to kind of point out some lessons from the airline industry. If you look at how airlines are coordinated across the world, it doesn't matter if they originate in Hong Kong or Dallas, they're all singing off the same sheet of music. And that's the reason that we don't see planes falling out of the sky or hitting each other as they're trying to land. And there's thousands and thousands of those daily, yet they all know the communications plan. It doesn't matter if it's United Airlines or it's, another one. They all communicate in the exact same way. But I want to point out that in the healthcare system, that's much different. So when we're trying to move a patient from point A to point B to point C, there are a lot of conversations that happen. They start and they terminate. And so EMS might get a verbal handoff from a first responder. That ambulance then makes a phone call or a radio call to a hospital, who then starts calling PBX operators, and all these different things happen, and they're little silos of communication. And so by the time this patient needs to get to a facility where they can actually get comprehensive care, there's been 100 conversations that have taken place, but really no shared awareness. And quite honestly, that's how drug cartels actually do it on purpose, because they don't want those things to be traced. Yet that's our standard in healthcare. And so it's kind of mind-boggling. So we like to take a little different approach, and we call this a red line. We create a dedicated patient channel for an event. And so what we do is 3 very easy steps. Number 1, we create a channel. We call that the red line. And then we can start to build whatever team we want. So we start to dynamically pull people into the conversation as necessary, so that there's shared awareness and everybody's on the same sheet of music, much like the airline industry. And then we simply communicate with those folks using current technology instead of picking up a phone or sending a fax or an email. We can also add and bring data in. This is just examples of, let's say, a cardiac monitor where we're bringing in EKGs, or we're bringing in images from CAT scans for a patient with a stroke. We can also send data out. So at the end of this, we can export this to multiple different sources. So the basic building blocks of Pulsara, this is kind of that networked communication, but in a visual format. Any organization can use our app, they can start a channel, and then they can add internal team members. And so with that, it could just be like an example of a patient that drives into an emergency room and they're having a cardiac event. And so the emergency room starts the channel, and then they bring in a cardiologist or a cath lab team. And it may just stop there because they have everything that they need to take care of this patient. But should this patient exceed the capacity or the capabilities of facility number one, they can obviously make and bring in a second organization into that channel who can also add internal team members. Maybe this is just, I need a consult with you because I need your opinion, or I need to actually transfer ownership. Now, organization two could also add another organization, and on it goes, so that we can start to build the collaborative care team that we need in order to solve the patient's problem. The key to this is that everyone gets pulled onto that same dedicated patient channel, or what we call the red line, so that if organization number three sends a text chat, organization number one and organization number four see that at the exact same time, and we can all collaborate. So our app is a HIPAA compliant app, and it also allows you to leverage a lot of the things that you appreciate about normal everyday communication in some of your messenger apps and your WhatsApps and things like that, only it's in a HIPAA compliant environment. So you can use things like team messaging, you can use live video, share audio clips, upload images, all of those things to really try to paint a better picture for whoever it is you're trying to collaborate with. This does have billable telehealth. We have plenty of organizations today that use this in order to see patients remotely and actually get a visual on them. It's much like HIPAA secure FaceTime within the app, and then it brings everybody into that same unified channel. So I'm going to give you a few major interactions, and these are just examples. Let your mind go wild with this, but these are some things that normally and typically we find that people are using our app for. So the first scenario is EMS gets on scene of a patient and they start the channel, and instead of using a radio or using a telephone, where clearly I can't over the radio give somebody's demographic information or send a 12 lead through the radio, but yet through the app I can very easily. And I could also initiate a live video telehealth call with the doctor in the ER if I so chose to. So that's a very simple interaction. Well, let's say this patient is critical. And so when I send the patient to the hospital, they say, wow, I need to get a care team established. And so what I'm going to do is I'm going to start to build that team even further, and I'm going to add the people. So I'm going to activate certain teams, and this could be cardiologists, this could be stroke neurologists, radiologists, people like that, or trauma teams that need to now collaborate and have eyes on that patient well before they even get to my emergency department. So then another is, and this has really come to light with COVID, is I am on scene with a patient and I'm not sure I need to take this patient to the hospital. How can we reduce surge? How can we do better for our patients and be more responsible? Well, we build these collaborative communication hubs in regions. And so those MOCs, if you'll remember that term that we talked about, act as a navigation network for EMS. And so EMS simply consults that collaborative communication hub and says, we have this type of patient and we need these resources. At that point, they can add those resources to the channel. Maybe this is mental health, maybe this is substance abuse or an on-call doc that can remote in and see the patient. At that point, maybe they don't need a hospital. Maybe they need just to be referred to a mental health specialist or something like that. So easily those things can be coordinated through the app, or if they do need to be transported, we can find the right destination. This is what we did a lot of in Austin with load balancing. So EMS would say we have a potential COVID patient. It would go to the medical control. They would say the next hospital that has capacity is this one. So we're not overloading any one hospital, and we're doing this thing more responsibly. And then finally, another really good interaction, and those of you in the EMS environment know the terms community paramedic, mobile integrated health, ET3. Our solution can really be used for this because 911 caller calls, and we've got people in Austin again and other regions, Colorado Springs, Montgomery County in Texas, that when the 911 call is initiated, in the 911 center, they initiate Pulsara. And then they bring in those other resources that are needed based on the complaint of the patient who's calling. We can also send an invite to the patient through our app, And it allows whoever we bring into that channel to actually have a remote telehealth visit with that patient. And we haven't even rolled an ambulance yet. So we're utilizing resources in a much more responsible way. But then finally, if they do need to be transported, and maybe it's not to an actual hospital, but maybe it is to an urgent care or something like that, we can simply add EMS into the channel and then add whatever destination they need to go to. So then finally, and this is going to lead into our big use case that we're going to talk about, which is hospitals that are at capacity or have a patient that needs to get out and they need to coordinate the movement of that patient. We can set up communications where a hospital can start a channel and they can say, I have this type of patient and they need to be moved. We can either link a transfer center, which is quite typical in normal operations, or in disaster operations. And what we're going to cover here in the Texas situation is a MOC. And so that MOC can act as a care coordination navigator. And so the hospital initially hits them and says, we've got this patient, where can we send them? And then the MOC can add as that navigator and then add in the people that they need to add in to help figure out the destinations, add EMS or whatever transport mechanism to the channel, and then also the receiving hospital. So just to give you a little taste of what the user interface looks like, we've been talking kind of broad scale here, but this is just us starting a patient channel. This is EMS maybe in the field that has a stroke patient. So you can see they're adding in a little bit of information about that patient. If they don't know the name, it's fine. They can just click unknown, but they can start now saying, I have a potential stroke patient, which then gives them the ability to set some of the things that they may need to document, like a last known well time or a stroke score, and then finally put the destination into the channel. They can also utilize that camera feature. So if they want to give more context to this patient, we've got driver's license, we've got insurance, we've got medication list, here's the patient's facial droop or their EKG. These are all things that they can share very easily through the channel. And again, anybody that's added to this channel at any time gets to see that historical perspective of that patient. When I send the initial alert, we can determine who gets that initial alert. In this case, maybe we have a stroke neurologist, we have a registration person, we have a nurse that gets the alert at the same time. And then if they wanted to add more team members to the channel, they can just simply click activate. And in the background, we can already set up a lot of relationships where we determine who gets that alert once the activation takes place. So let's talk a little bit about disaster movement. And I know RumbleUp's going to talk about one of their use cases as well. And that way you really have something tangible that you might be able to use these products in these different environments. But we talk about disaster patient movement. One of the things a lot of people have figured out is the data and logistics part of this, right? So they have things that can help with determining who has bed capacity and things like that. But what they don't have is a good way to communicate in real time. And so that's been a huge gap that has been exposed with COVID. This was largely a medical thing instead of an operational thing. And so the data and logistics were figured out, but really coordinating that care and keeping everybody in the loop was a huge gap. So I'm going to talk to you a little bit about the surge in Texas. As you know, we, like a lot of states, have all had our surges and then our declines. And so in our biggest peak out in El Paso, we were asked to step in because we'd already deployed this in the Austin area and in the San Antonio area. It already worked well. And so the state asked us to come in and really help move patients from all the way out in El Paso to different parts of the state. And as you know, Texas is a pretty large state, so it could take you 13 hours at least to get from El Paso to East Texas. That is a large swath of land. So what would happen is that a hospital could start a channel. We set up relationships with their local MOC, and they would act as the very first point of contact to say, do we have an alternative care site close that we might be able to send this patient to? Do we have another hospital in our region that we might be able to send this patient to? Most of the time that was a hard no because they were under such influx. I think we moved over 200 patients within a 2-week period of time through this system and out of El Paso. So they hit the state coordination center. And then the state coordination center would look and say, who's the next region we need to send a patient to, again, to do that load balancing mission. Now, the region is in the channel, the sending hospital is in the same channel, the state is in the same channel, and now they would add the appropriate region into the channel that could then send it to the final destination. And then here was the big key. Adding that transport resource into the same channel was huge. I will tell you that if you wanted this to scale to like a federal level or something, you absolutely could do that. But when we first got to El Paso, this is what it looked like. 30 plus phone calls to move a patient, and there was no shared awareness. So if you think about this for a second, where a hospital would hit their local rack, their mock, and say, we have this patient that needs to go out. Okay, I'm going to jot down all the information, and then I'm going to make a phone call to the statewide coordination center, and I'm going to give them the same information. At that point, they need to make phone calls to each of these other regions and start passing on the exact information. And then finally, once we have a destination hospital picked out, we have to make the phone calls to them. So now we need to add a transport resource in. So that's a phone call. Once that transport resource is on the way, they're calling the state coordination center saying, we're in flight, we've landed. We had multiple incidents in the early days where a patient would get in flight and outbound from El Paso, and they would make a turn for the worse, and that aircraft needed to turn back around and go land. Guess how many phone calls it took to actually create shared awareness for all the people that needed to know that took place. So once we deployed Pulsara, we got this down to literally 2 phone calls or so, and everything else was done within the app. Huge shared awareness and a lot better user experience. So in final, I'm going to say that if you remember that mock definition, Pulsara enables the flexible interactions to achieve the goal of the mock. We help to move those patient, staff, and supplies to the right provider at the right time, in the right way, to improve that patient well-being. So again, that's sort of the story, one big use case of how to use Pulsara. There's tons of them, as I showed you. So thanks a lot for the time, and I'm going to turn it over to Spencer, who can tell you about RumbleUp.
Thank you, Corey. I really appreciate that. I think one of the coolest things that you were talking about is systems of care that scale. I think that really hit home with us at RumbleUp. So thank you, guys. I'm Spencer Sullivan, Vice President of Partnerships at RumbleUp. Thank you to FirstNet for hosting us. Thank you for the work that you guys do. I know we at RumbleUp were very excited about this idea, because I feel like we've joined so many webinars that have been kind of downers and just kind of in the time period that we live in through now. So it was awesome to share about this story about Dutchess County and the way they took their innovative approach to contact tracing. So we're coming from this on the COVID front. We're coming about this RumbleUp from the contact tracing front, how texting helped Dutchess County and so many other counties throughout the country. County Executive, Mark Molinaro will be joining us here soon to give you his perspective from Dutchess County and their experience using RumbleUp. So that's been a big help as well. First things first, RumbleUp is a peer-to-peer texting provider. We're a platform that allows organizations like Dutchess County, like any government entity, to connect with their citizens, with their residents, with their targets at scale in a very personal and scalable way. And that's why, Corey, I really liked your line there about systems of care that scale. I think, to me, that hits home very much so. So, what we were able to do in terms of working with Dutchess County on the contact tracing front was able to allow counties to not only inform quickly people who tested positive. We'll talk more about that as we go along, but they were also able to hear from their residents. They were able to answer questions about, hey, how many ventilators do we have in the state? Very personal questions about, hey, I need some food, but I can't leave my house. They're also able, many counties were able to organize and text to coordinate not only their contact tracing efforts or the case investigation efforts, which we'll talk about, but also to let people know, like, you are now eligible to get the vaccine. Here's the link to click to sign up to get the vaccine. Here's directions to the appointment. And don't forget about your reminder 2 weeks now that you have another shot coming up. So many different ways that RumbleUp is able to partner with counties like Dutchess County and help them through this pandemic. And it's, I think, one of the most important things to recognize here is that two-way genuine conversation. I think it's very easy to talk about products like RumbleUp or Pulsara and remove the human element out of it. Corey did a great job of talking about some of the specific use cases of where they had to turn the helicopter around. But let's not forget about the human element of folks here who would receive this text message, who were worried, who were concerned, but were able to have that engaging two-way conversation with the county executive, with his staff, with the health department. The counties themselves are had to fill in a gap left by either the federal or state entities, and these counties were very much on the front line of trying to fulfill those goals set by the state or the federal government. So the landscape in the beginning was scary. It wasn't great. It wasn't ideal. It wasn't just in New York. It was all over the country, right? And so kudos and credit to Dutchess County and the work they did to identify that, hey, we need a better approach to this contact tracing front. We need a better approach, the conventional way of calling people, to let people know that you've tested positive just isn't working. The staff burden, it just wasn't working out. And my favorite line here, if you guys want to take a look at it, is Pew Research did a study that only 19% of American adults pick up a call from an unknown number. And I was thinking about that just before this webinar, and I go, those must be the 19% of adults who are really concerned about their car extended warranty expiring. Because those are the only calls I get that kind of suffer me into picking up every so often. I do believe we have County Executive Molinaro on now. County Executive, if you're, do you want to paint a picture of the context if you're on to some of the challenges that you guys were facing on the front of Dutchess County when it came to contact tracing, in the very early days?
Sure, Spencer. Thank you. Can you hear me? Okay.
Perfect.
Good. I'm glad. Thanks for including us. First, let me tell you, Dutchess overall was and remains very satisfied and grateful to use RumbleUp as a tool. We kind of, and I hate to say that we joked about this, but during the entire response to the pandemic, the line we often all used in local government was we were building the plane as we were flying it. A lot of what we knew we needed to do in establishing mass testing, conducting contact tracing, which for public health departments, to be clear, is not new, right? We've been doing contact tracing since the days of polio. Generally, admittedly, these more recent years, a much smaller scale, generally for STDs, but the infrastructure for contact tracing was there. However, scaling up and the massive increase in identifying and communicating with a positive case and then their contacts was just seemingly insurmountable. And as you know, we didn't make use of RumbleUp early on. It was midway through our contact tracing process when we really did need to transition, because as people were getting back to living, and we still in New York still have these restrictions, every one positive case early on in the pandemic may have had 2 or 3 contacts. As we got later on in the pandemic, may have had 10 or 12 contacts. And so when you're dealing with 1,300, 1,500, 2,000 active cases, immediately communicating with people who may have contracted the virus or maybe a vector to transmit the virus, communicating with them instantly was necessary. And I don't know if you know this, but a lot of people don't like answering the phone when government calls them. So the traditional way of communicating with our constituents, I mean, social media and those tools, really not appropriate for contact tracing and responding to a positive case. But picking up the phone and manually making those calls, 60% of our constituents don't have a landline to begin with. Most of them don't answer the phone when anyone calls, whether it's a car insurance, a customer service rep, or worse yet, government. And the information we needed to get to them was very simple. We didn't need to educate them with a lot of this. It was, you came into contact with somebody who's positive, here's the contact information that you need to make use of and communicate back with us. And RumbleUp gave us the tool we needed at the time we needed it. And I'll say this candidly, we didn't use it in a sophisticated way. We used it as a way of immediately and quickly contacting individuals so that we could slow the spread, but as importantly, give them adequate information that they could react to.
No, that's good to hear. I do have one question, and I don't want to skip over this concept of the county government. I think county executive, if you could speak more to kind of the gap that was just left from the state, right? That really put you guys on the front line of trying to get these programs executed and chased down. I think a lot of people undervalue the work, the pressure that you guys were under, county by county, state by state.
Well, it's interesting, and I appreciate you bringing that up, and I'm happy to talk about it. So, whenever the president announced that they needed to expand the delivery of PPE, whenever this governor or any governor had a conference, a briefing, this governor had a lot of briefings, daily briefings. Whenever they announced that we needed to expand testing, whenever they announced that we were going to do contact tracing, we were going to get vaccines roll out, in New York State, it meant the county health department would have to affect the announcement. In this state, public health and the response to a public health pandemic, a public health crisis, a pandemic in this case, is county government. We are the arms of the state Department of Health. Now, in other states, the state health department may well have a local office and they do the work through the state government. In New York, it's county governments, except the city of New York, it's county governments. So across America, 1,900 public health departments administered by counties, 1,000 hospitals administered by counties, all on the front line of this response. In particular, in this state, testing went better than contact tracing, which went better than vaccine rollout. And so to the point of gaps, the state would say that here are the rules, right? And we know what the CDC and we know what the State Department of Health said. You test positive, you're basically quarantining for 14 days. Anyone you've had contact with for more than 15 minutes within 6 feet needs to be notified. They too have to isolate, monitor their health, and then should they have contracted the virus, they too would have to go through that same process. The state didn't tell anybody how that was going to happen. So counties like ours, Oneida County, I know used RumbleUp as well. Counties like ours had to assemble an army of staff. And in many cases, we hired up part-time, temporary, hourly staff, some volunteers. In my county, we went from something in the neighborhood of 300 active medical reserve volunteers to 900 active medical reserve volunteers in the course of only 6 months. Those are the individuals who were trained. We trained them on contact tracing and understand the resources and tools that were available. So when we made the contact with the individual, they needed to know who they were communicating with, what services, resources would be available to them. If they're isolated and a spouse is healthy and at home, but they can't isolate from the spouse that isn't, well, we need to put them up in a hotel. We're doing that sort of work. The state didn't give us those resources. We had to assemble them. And I will tell you, 62 counties across the state, we worked together like never before. And I'll be very candid. I learned about you through Oneida, who said Oneida County was starting to use RumbleUp for contact tracing. We said, this makes perfect sense. And it allowed us to fill the gap in communication, which saved us time and resources to be able to build up the other aspects of that response.
Yeah, I think you hit spot on. So we're going to keep going on the presentation. You definitely unpacked a lot there, and I'm going to ask you towards the end of this presentation. But you hit spot on the challenges of what Dutchess County was facing, but also counties across the country are facing. Where how do you quickly inform people that they've tested positive with the hope of stopping the spread, reducing the spread, slowing the spread, right? And phone calls just weren't working. And you guys had to hire up, like you said, from 300 reserves to 900 reserves, to really implement this program to fill that gap that the county was facing from the state and federal government. So,
and can I say this? Yours is a very solid, and I'll stop it. A very simple tool that people accept. They didn't have to download an app. They didn't have to call up the government and say, here's my healthcare information. All we did was use their cell number, which they're very common. We receive texts all the time. They were not offended by it. It wasn't anything that felt intrusive, but it allowed us to respond very, very quickly.
And I think you hit something on there too, that part of the problem, I'd like to focus in on the staff burden that your staff had to face, the other county staff had to face, and filling out these very labor-intensive forms that were required by the state. I mean, rightfully so, right? But maybe the app or the program itself wasn't intuitive. Maybe it took a long time to fill out the demographics and where these people have been. And so, your staff, other staff across the country were forced to kind of force upon this very bureaucratic program of filling out these COVID questions. And so it's great to hear that your staff and folks around the country were able to use a very simplistic, I like what you said, not sophisticated at all. I'm not very sophisticated at all as a person, so it's great to hear when other people are using it in the sense of it was just easy to use. And that's why we kind of built this in terms of very easily. I mean, the day-to-day process for a lot of these counties for you guys was you have a list of numbers that you need to inform that they were positive. Some are landlines. You can scrub those landlines out. So for an example, let's say you had 100 people to call. You scrub those numbers against RumbleUp. Now you realize out of those 100 numbers, only 25, 30 are landlines. So now your staff only has to focus on 30 calls, and it can text out the other 50, 60 numbers via text. And it ebbs and flows, right? I mean, Corey was saying before, every state had their ebbs and flows of a wave. Every state had their ebbs and flows of surges. So being able to say, whether I have 100 cases today or 1,000 cases today, I'm able to text out pretty quickly to let people know you've tested positive. And here's a link for your resources. I don't want to skip over how personal these texts are, or just the resources that you guys were able to provide in terms of, here's a link for if you need help. Here's a link if you need food delivery. Here's a link if you have any questions. And engage in that two-way, very authentic conversation. And something County Executive you touched on was kind of that case investigation. I mean, contact tracing is only one part of it. Contact tracing was, hey, you've tested positive. It's you need to self-isolate. The other part of it, which takes a very long time for the folks on this call who probably already know about this, is you also need to hop on a call with that individual and say, hey, where have you been for the past 2 weeks? What are your demographics? Who have you talked to? What establishments have you visited? And those calls, I mean, County Executive, I've heard from anywhere from 30 to 45 minutes in terms of what those calls take. Have you heard the same?
Yes, that is absolutely true. And so to be much more efficient in that communication was and remains very critical. And to your point, we in my county, we were down to about 700 active cases only 4 weeks ago. We're now back up to 1,500 active cases. We went from no clusters of any kind to 100 in one day in one location. Those 100 each had 4 to 7 contacts. So the demand ebbs and flows, and staffing becomes challenging, right? Especially with temporary staffing. You don't have a mechanism that you can always staff up or staff down in a moment's notice. So the tool allows us to kind of maintain that level of communication regardless of the total number of communications and the staff assignment. To your point, and I too don't want to or speak over the connection. We've had people say, "Are you really there? Is this really somebody?" And so, to that point, in 2020, 2021, texting back and forth is how we communicate. I mean, I rarely have to pick up the phone anymore. So having the tool, as simple as it is, to have a government contact tracer communicate back and forth. Here's where you would get your test. Here's where you would go if you need food. Do you need residents in some sort of shelter while you're there? Are there others that might have vulnerabilities? We're able to have that two-way conversation in a way that speeds up that process and allows us to move to, and I hate to put it this way, but move to the next case. Isolate and provide the resource and the support, and then get on to the next one. Because we were dealing with thousands upon thousands of contacts. And I will say, we cut our backlog down significantly the second we sent out our first batch of texts. And it sliced into that backlog, I would tell you, by 30 or 40% instantly, because people got the information that we were trying to give them, and that's all they needed.
Yeah, and I think so that obviously great to hear. I mean, the speed of it and just having government work in a very effective way is not always the case, right, county executive? But that's something you guys were able to do. Credit to you on that front. Part of what we're talking about here is that some counties were able to text out the survey to the case investigation. So not having the case investigator spend 30, 45, 50 minutes on the phone call or missed calls or voicemails with the intended recipient of where they've been, the establishments they visited, who they've been around. The recipient was able, in a very safe way, able to fill out the survey on their phone on their own time, removing the burden from the staff who's already burnt out. It's tough to scale up and scale down at that level, and get those responses back into the state mandated form as needed. It speaks to the speed of the medium, the effectiveness of the medium, but also the budget. I mean, a lot of these counties are very tight budgets, and it can be restrictive. So being able to communicate in a way.
When I asked what the price was and they told us, I said, "Are you sure it's not more?"
Well, that's good to hear.
Yeah, we did not use it for the individual to do the survey because we still wanted to maintain sort of that connection. But again, we could have if we needed to, and so that immediate interaction was what was of great value to us.
Completely, and just clearing the backlog, having those two-way conversations, having that medium open to where it needs to be. So our goal here at RumbleUp when working with counties like Dutchess, and this is just so exciting for me because it's been months and months of working on this stuff and seeing the results, but being able to share a good positive story from it is so uplifting to me, and I hope to the folks on the call. It doesn't matter the size of the county. It could be, and I think this is a very good point here too, is, we heard a lot about New York City, where, you heard about these big cities, LA, Syracuse, wherever, all over the country. But there's a lot of counties that are just suburbs of suburbs, and they need the help, and everyone's budget is stretched, everyone's staff is stretched, and so being able to help out and communicate quickly and effectively in a very cost-efficient manner, but also garnering those two-way conversations between residents and people who've tested positive. But also, we can't overlook the isolation of how many people face. So receiving a text from whoever is very positive, and I think one of the very common misnomers I want to correct is that texting is only great for the young generation. And I completely disagree with that. The same reason why your parents and my grandparents got on social media was because that's the only way they were going to see their kids or grandkids. And so that's the same reason why grandparents and the older generation is texting, is because that's the only way their kids are going to pick up the phone and talk to them via text. So receiving those text messages are very welcoming and informing, and letting know someone that cares that you're not as self-isolated. So some of the cool ways that other counties and across the country have used texting, partnering with RumbleUp, is to let people know that you are now eligible to get the vaccine. To remind people your appointment for the vaccine, is tomorrow, and here's the link for the directions, and here's your reminder for the follow-up. It's ongoing, and I think one of my questions in a few minutes will be something different, but it's really easy. I think County Executive Molinaro put it perfectly. We didn't use it in a very sophisticated way, but it worked great. RumbleUp was designed to work very quickly. You can send text from the desktop, people receive it on their phone, they can engage and respond, and allows contact tracers, your staff, your individuals to have, to manage 500 conversations or so at a time, in which via a phone call was never possible. So what I'm going to do, we'll send the slides out. You guys will receive the slides. If you want to text in to get the FirstNet, let's do it. County executive, I'm going to go back to the Dutchess County homepage, because you guys have a beautiful county. If you're able to turn on your monitor, I would love to ask you a few questions for the attendees.
Do you need me to do anything? I'm here ready for you.
Oh, you're good. You're good.
I can see you. Yes, I can see the monitor. I can see it all.
Perfect. So one of the things you brought up was the contact tracing. I do think a lot of the focus, probably from your perspective right now, is vaccine distribution, getting people signed up, and the success of that, right?
Yes.
But contact tracing is going really nowhere anytime soon. So I guess from your experience, or your perspective on the ground, how do you envision improving your county contact tracing program, incorporating texting, or what things would you do differently moving forward to sustain such a program?
Well, admittedly, we lean on you a lot more. I mean, honestly, at some point we're going to start scaling down staffing, but need to maintain the ability to rapidly connect. And instead, in our case, of simply using it for the initial communication, we'll end up leaning on the technology more to have that the individual complete their own survey, to have some interaction back and forth, so I can maximize our reach and minimize our staff responsibility. And to your point, it isn't going away, certainly not until we've gotten through the tunnel, right, where there's more vaccination. When we get up to the 60-70% level of vaccinations, we're still going to be having this level of contact communication. And the more I can automate it, I mean, for all of us, I mean, government just can't sustain a war footing, if you will, right, an emergency response infrastructure for years. The whole point of it is to get through the emergency and then start to scale down. So I think using RumbleUp, we'll be able to scale up the service, scale up the response, and then scale down the staffing.
Awesome. And I think, we talked a lot about, I mean, my focus was kind of trying to highlight the gap between state and county work, the staff burden, and then you guys looking for innovative solutions there to address those needs as you guys had to. Did we miss like an untold story, or from your perspective, did we miss something here that we glazed over, something you want to highlight in terms of, your experience with Dutchess County, the contact tracing program, and everything you guys have been through in the past year and a half or so, that we might have glazed over, just haven't seen, because we're not on the ground like you are?
Well, listen, you kind of said it in one of your remarks, and I'll get to it in a second. I do want to reemphasize, though, the New York State technology, what we had to lean on, their database, their tools. I'll say respectfully, New York State's been driving around in a 1980s station wagon when it comes to technology, and frankly, it is not sophisticated. It is outmoded and overwhelmed, and so trying to come up with sort of these tools that could at least fill the gap between the less effective and less sophisticated and more antiquated state system to what people expect, right? They expect that we are more sophisticated technologically than we are, was and remains critical to us. And to that point, in this, where we live in Dutchess in the Hudson Valley, you're watching the New York City news media market. You're watching the news. And so what you see occurring in New York City, even though you logically know it's not exactly what's happening here, you still feel that influence. So the tools and the resources New York City's using, residents kind of expect, well, that's what we get. The challenge and the problem New York City's facing, well, then that's kind of the challenge and problem we're facing. So we are influenced in that way. And I will say quite candidly, we need to look like, if not actually act like, we are as effective and sophisticated technologically as is necessary, because people expect it. But I will say to your point before, and I would want to reiterate it, even a text message from somebody on the other side of a government laptop or desktop was comforting to people during the most challenging 14 months of several lifetimes, right? We have gone through a lifetime now, these 14 months of upheaval, unprecedented economic toll, unprecedented public health toll, unprecedented in many ways political environment, and civil unrest. So many people were scared for a lot of very valid reasons. And just getting that interaction from somebody that they felt they trusted, and local government has a high level of trust, was comforting, was helpful, and was really put their minds at ease. And so, so you give us a way to communicate with people when maybe there just weren't any other ways to do it, right? We're all isolating, we're all locked down, we're all somewhat distant, separate from one another. Don't undervalue that. And I, while I could point to hundreds of stories, I can tell you that I think in the greatest moments of fear and concern during these last 14 months, most residents felt comforted that they had at least a level of government that was communicating with them, and you helped us to do that.
Awesome. No, thank you for all that. And I agree. I think giving local government, and not so much state or federal government, giving local government the tools, because you could text someone and see them at the coffee shop or at church or wherever, and that's the empowerment there. So
a lot of folks wanted to tell me that they got my text message, so I appreciate it. It wasn't necessarily from me, but I will say, listen, right? We are at a time where trusting government is probably at its lowest ebb in a while. I mean, it just is. However, local government, Pew Research, others have polled, local government still has a 60 to 70% trust factor. You tend to believe and trust your local government, mostly because you see us, you know us. And so being able to use a tool that allows us to maximize that trust in a moment where, trust is the currency of leadership in an emergency was in many ways invaluable.
Awesome. Well, I really appreciate your time, appreciate your perspective. It's cool to hear from the vendor, but it's much cooler to hear from someone who actually used it and experienced it, on the front line. So thank you so much for your time, County Executive. I'm going to pass it back to Danny here for any questions about RumbleUp or Pulsara from the attendees.
Awesome. Thank you, gentlemen. That was all really great information. So I really appreciate you sharing all of that. So we will now have a questions and answer session. Remember, if you have not yet submitted your question for the panel, you can still do that. Use the questions panel on your control panel. So our first question, and I think you touched on this a little bit, Corey, but if you all could go into a little bit more just how your apps and everything can protect patient and resident privacy and prevent breaches and stuff.
Yeah. Well, when you think about the normal means of communication these days with fax machines or radios, if I were, let's say, an EMS agency and I'm calling in a radio report to the emergency department, and I did this for years, by the way, and I've been on both sides of it, that goes to a common radio like speaker in the ER. And so not only does the charge nurse hear that whenever the EMS agency is calling it in, but so does whoever's in bed 11, 12, and 13, right? And so how secure is that? With Pulsara, when you're sending it, not only can I send protected health information, whereas I wouldn't be able to do that over the radio, but also it's going to the right person. And that person gets an alarm, but then they go see it and they're the one seeing it. And then they add only the right people in to see that. Other ways of sending medical records today via fax, you may have somebody come and just grab it off a fax machine, right? And so it does offer some exposure risk with those antiquated ways that we used to communicate. So I think Pulsara does a nice job of saying only the right people need to have this in their hands, and we'll enable those flexible interactions.
Okay. Anyone else have anything to add to that one? Okay. So the next, our next question is, how can these apps handle situations where there's limited or no connectivity or internet or mobile coverage?
Yeah, I think probably both of us feel that. I mean, obviously, in order to communicate, you're going to have some type of connectivity. Now, we don't care whether that's cellular connectivity or whether that's Wi-Fi connectivity. And even by sending images and things, it's a very, very small strain on the data. So from our perspective, you can still document within the app if you lose connectivity. And then once you pick that back up, it can then send the latest information. So that's from the Pulsara perspective. Yes, you have to have connectivity, but it doesn't matter if you lose it at some point. You can still do what you need to do.
Great, awesome, thank you, Corey. Okay, Spencer, for RumbleUp, can RumbleUp send videos?
Yeah, so that's actually a really interesting question. The one of the things we didn't touch on in terms of like a specific use case that we do quite a bit is we can compress a 30, 60, 90-second video to the recipient. And so when it comes to contact tracing or COVID development or comforting someone, right? The local county executive, the local health doctor can talk. We've sent out videos talking about washing your hands and best practices, social distancing, stuff like that. So we've been able to help a lot of entities in terms of sending out what could be a very boring text or a link that people don't click, but an engaging video and talking about best practices of washing your hands and social distancing, and ways for a county, whether it's the health department or a county executive to give an update. We've texted out videos from governors talking about their daily COVID update, which was a very a common thing around the states or county executives. So absolutely, we think that that's where the industry is leading.
Awesome, great, thank you. Corey, in terms of Pulsara, how fast can the technology be implemented? Does it take very long to learn or set up for an organization or multiple organizations?
Right. So, I mean, obviously the tool is pretty versatile. So it really depends on scope, right? For EMS to hospital communications, EMS, they can be up and running within a matter of an hour. I mean, quite frankly, it's pretty simple. And during COVID, in the load balancing program with Texas, we actually created an automated system where hospitals could sign up online. They would get sent their first invite to be an admin. And then literally it's a matter of downloading the app and putting it on some communication device. And so, we got probably 100 hospitals up and running within a matter of days by doing that sign up process. And then they had direct communication with their local MOC. And so it really doesn't take that much time. I'll say that the challenge with that is, and I think COVID forced people to do change because it was a necessity. And before COVID, a lot of times getting things implemented was a long drawn out process because there's so many different red tape layers, right? But with COVID, it was kind of like, hey, we have to do something. Our hand is forced here and we are overloaded with patients. So give us a lifeline. And in that case, they take those walls and barriers up. And so the process went very smoothly.
Awesome. Great. Thank you so much. And then it looks like we have time for one more question. Spencer, on RumbleUp, where do you see texting fitting into the future for a county or a state?
So I was like taking a lot of notes when Corey was speaking during his presentation, because I thought that was like awesome. And one of the things he said was, hoping that these innovations that, cutting through the red tape, hoping those innovations go beyond COVID, right? We've adapted, we've been innovative, we've used new programs, new platforms, hoping that sustains after COVID, right? So I think part of that conversation with the county executive Molinaro was, contact tracing is really not going anywhere, and so that's going to be a forefront. Having these local state governments be able to communicate very cheaply, very effectively with their members about, hey, I need this the street plowed or whatever it may be. So just local communication services. But more importantly, just hoping, like Corey said, making sure these innovations, these advances we've made, that we don't go back to where we were a year and a half ago, streamlining the process, cutting through that red tape, and delivering these innovative products, these platforms to the constituents, to the residents, to the hospitals, to the people who need them.
Awesome, excellent. Well, great. That's all.
Yeah, can I add a little bit to that, if I could? Because I think, Spencer, you're definitely onto something there. Is one thing that none of us could do throughout this webinar is take a phone call, right? I mean, we had to be in the here and now, but guess how many text messages probably all of us have answered while we're on this webinar? And I have found that there's just been monumental gains by offering that, what I call asynchronous communication method, instead of always having to take the phone calls. And so not only is it an economy of scales for those that are trying to communicate with people outwardly, but also it's, man, if I'm the doctor and I'm taking care of a patient, I can't answer a phone call right now. But boy, I could have somebody with something in front of me that I could read really quickly, and then they could respond back. We just get so much more done. So it's a great point, Spencer. And I'm going to tell you, I was impressed. I applaud you guys for doing what you did. And I'm glad that Dutchess was able to have success with that.
Yeah.
Awesome. Thanks, Corey. Appreciate the time. Hey, thanks to FirstNet and Danny and Suzette and everything. This has been great.
Yeah, and thank you to both of you. That was some great information throughout the presentation, and I really appreciate those comments just now, Corey and Spencer. I think it really kind of shows where we're going. But anyway, that's all the time we have. If we didn't get to your question, we'll work to get the answers and follow up as soon as we can. Again, a recording of the webinar will be emailed to all registrants and will be available at www.mccmag.com. A certificate of attendance will also be attached to the email. Also, we would appreciate it if you could take the time to fill out a quick survey on how we did today. That will pop up as you exit the webinar. And please tune in to our next two webinars in our series. On April 15th, we'll talk about FirstNet solutions for medical emergencies and HIPAA-compliant data sharing. And on April 22nd, we'll talk about FirstNet solutions for managing testing and vaccination logistics. Information on how to register for those webinars will be in your post-webinar email. Thank you again to our presenters and attendees, and to FirstNet, built with AT&T, for serving as the sponsor. That concludes our webinar. Have a great rest of your day. Thanks, everyone.